This video is all about dyslexia, from busting some of the myths to looking at the key symptoms and also thinking about how we can help someone with dyslexia. Let's bust some myths. Myth number 1. Someone with dyslexia is not very clever. This is incorrect. Dyslexia has no impact on intelligence. Some of the most intelligent people in history had dyslexia. Myth number 2. Dyslexia just means that you can't read or write. Again, not true. And this is actually very often misunderstood. There are many different effects of dyslexia. You could be great at reading and writing, but struggle with processing instructions or struggle with maths. These could just be different types. Which leads us on to our next one. There is one type of dyslexia. There are actually loads of types of dyslexia. Here are some of the most common: phonological, surface, visual, primary, secondary, and trauma. So you can understand how two different people with two different types of dyslexia could experience it very differently. And myth number 4, dyslexia is really rare. No, actually 1 in 10 people have dyslexia. So if you think of a typical class of around 30 students, 3 students in that class would have dyslexia. As we've mentioned, dyslexia comes in loads of shapes and sizes, so it's impossible to cover all of the symptoms. But here are some of the most common: reading slowly, confusing the order of letters, poor or inconsistent spelling, understanding information that's communicated to you verbally but struggling when it's written down, struggle with organisation and planning, put letters or numbers the wrong way around, finding it hard to carry out a sequence of directions, and struggling with reading aloud. Here are some more symptoms of dyslexia. These ones you might not have realised are links with dyslexia. It shows how different things can be affected by dyslexia: an inability to tie shoelaces, problems remembering information, not being able to break down words into sounds, having trouble rhyming, messy handwriting, difficulty reading a clock with hands, and not knowing your left from right. Now that we know some of the symptoms, let's see how we can help people with dyslexia, or if you have it, how we can make things easier for you. Using a word processor in exams or for notes. For some people, writing can be really challenging, and it's really helpful to use a laptop for exams. Top tip: if you are using a laptop for your exams, maybe it's a good idea to practice exam questions on the laptop, and maybe using the laptop for notes. Strategies for spelling. It could be really helpful to try and break up the words you're trying to spell, or come up with a rhyme to help you remember. I remember I learnt big elephants can add up sums easily. This spells because. Note-taking styles. How you take your notes can really help how easily you take in information. Why not try a new style of taking notes? And if you feel overwhelmed by too much information on your page, try to take notes in brief points and then summarise to key words. Audiobooks. For those who find it difficult to read, audiobooks can be a great way of understanding the story without having to actually read the words that are on the page. A coloured overlay or coloured glasses. A coloured overlay is a plastic sheet that can be placed over books, for example. This may make it easier for someone with dyslexia to read, as sometimes black writing on a white background can be really hard to read. You could also get these lenses in glasses. Using a reading ruler. This is a similar idea to the coloured overlay. You can get reading rulers. These have a guided line which can help you keep track of where you are on the page. Ask for instructions to be repeated and explained in the most effective way. For each individual with dyslexia, the best way to take in instructions varies. Therefore, it might be that you need instructions either repeated or maybe just presented in a different way. You may be offered extra time in assessments. This can be beneficial to allow longer time to process questions or articulate your answers. There are loads of familiar faces of people who have dyslexia: authors to actors, successful business people to members of the royal family. With the correct amount of help and support, dyslexia does not need to negatively impact your life in any way. Many successful people are dyslexic. So what now? If you or someone you know is struggling with the things that we mentioned today, how can we help? When we have a formal dyslexia diagnosis, we can access a lot more help. The extra time and the laptops and assessments are just 2 that we've mentioned today. These changes can make a huge difference when it comes to exams. They may help you achieve the grades that actually reflect the hard work you've been putting in. There are a huge number of people who are undiagnosed. So first, talk to a parent or maybe a teacher, someone you trust. If you've noticed symptoms of dyslexia that apply to you from this video, then you can Google British Dyslexia Association and you can find all the information about getting an assessment on there. The length of assessment and the cost of an assessment can definitely be daunting, but the pros massively outweigh the cons when considering the impact a dyslexia diagnosis can have. So many young people with dyslexia fall behind in their studies, even though they're working really hard. I really hope that if you or someone you know well is struggling with dyslexia, this video has helped you recognise signs and hopefully encourage you to ask for some help and not suffer in silence.